good afternoon and welcome back to Digital Symposium 2018. I'm Jason Longden and I'm here with Digital Dentistry Society board members Julian Caplan and Sinead Mcenhill. How are you finding it, guys?
Oh, it's great. Yeah. Sinead, you've been here for 2 days.
Yeah, I've been here for 2 days and there has been a real broad section of digital dentistry on shows. We've had a really enjoyable time sharing opinions and all learning a few little fantastic nuggets to take home. So it's been a really well organised event and some of the speakers have been really top notch. So it's been very enjoyable so far.
Every year is good. Every year is good. So hopefully, maybe next year DDS UK will be invited along to give a lecture, we would hope.
Oh, lovely.
Perhaps.
Perfect, Julian. So what is DDS UK and why have you set up the society?
Okay, so DDS UK is the Digital Dentistry Society UK and it's part of a global community. So there are quite a few organisations out there at the moment who are involved in digital, which is fantastic and we love that. But I like the concept, especially with, dare I say, Brexit right now and the fact that we really are part of a bigger picture. And there was a lady called Henrietta Lerner who's set up DDS Global. And there's approximately 30 embassies, as we call it, throughout the world. And she's asked us to set one up in the UK. So that's really why we started it, because we want to develop the science behind digital. So there's a lot of information out there on Facebook and generally the social media with these great ideas, but we want to bring it down back into science a little bit more, and for people to be able to make decisions about why they go down the digital route or why they don't get down the digital route. So there's a little bit more background to it rather than, that sounds a great idea, let's have a go at it. So we want to bring it back down to a little bit more protocols, specify why these are good ideas, and hopefully develop an educational program.
Fantastic. And what can members expect from being part of the society?
Well, there's a few things. One is DDS Global has a yearly conference, so that's international speakers, and we as DDS UK are going to have a conference next year, hopefully in February, where again we'll have some international speakers come over. So that's the whole sort of taste of it, is that it's this global concept, which is a sort of a big thing. It's a global concept rather than being maybe a little bit more insular in our ideas. Secondly, we are looking to produce, linked with universities, an MSc or diploma or an MSc program. So we standardise the science behind it. We're going to do some hands-on programs linked with the other groups that are involved in digital dentistry in the UK right now. And then, as with all these things, as with Henry Schein, it's this networking business, isn't it? You know, it's talking to people over a glass of wine. Oh, I do this and I do that, and which is great, and that's sort of also what we're about.
So community in the society.
Very much so. Yeah, we've got at the moment we've got a website, and we'll have online programs for dentists to go on to learn more about the different aspects, all those multitude of aspects of digital dentistry.
Fantastic.
And with that particular conversation, and as you said, the networking that you just mentioned, I coincidentally met an old friend of mine who happens to be one of the original co-founders of the Global DDS Network, Marcus Abood. He's from the States. He's the Dean in Kentucky University Dental School. Incredibly academic and has been doing research for many, many years. And he absolutely agrees with the importance of DDS and protocoling everything so that everybody learns the best, safest way for patients to be treated. And he has agreed to come over and open the Irish aspect of DDS in Northern Ireland, which will be in September. So hopefully we can attract a large number of people to see a really pretty world famous name.
So hot off the press. News.
Hot off the press. I just follow that up with an email tonight.
Yeah. Wonderful. And from in terms of the DDS, what are you looking to achieve with DDS? What's the plan?
Well, again, it's really the education. So at the moment, just because we can do it, doesn't necessarily mean we should do it. So, and that's what we haven't got at the moment. There's lots of these different aspects which are being thrown at dentists, and it sounds, fantastic, what the digital workflow, and of course we're very pro that, but provided it's within a certain remit, certain protocols of, yes, this is a good idea, or it's a good idea, but we're not quite there yet. So for the masses, maybe at the moment you shouldn't touch it. So there's some control over it, I feel, needs to happen, which is really, again, this this concept about looking internationally and seeing what everybody else is doing in the world and looking at the research that's being done on those subjects, like with Marcus and these various other academics. And that needs to be, we feel, brought back into digital a little bit more. I mean, I've been involved in digital since 2001, so, a long time, since I was probably about 10. Something like that.
10, of course.
Probably. So I've been involved with it for a long time. I've been banging on about it for a long time, and now, of course, in the last 5 years, everyone's got hold of it. But little bit of control.
So much in terms of what's available out there. That's the problem. So everybody needs to recognise their own needs, but also be much better informed, I guess, before they make decisions on what they should purchase. Everybody wants ultimately to have a set of equipment that gives them fantastic return on investment, decreases stress, increases their profit, but also is the best for their patients.
Happy patients.
Yeah, and that means happy patient, less stress. It works for everybody. And patients in this day are so empowered about their treatment planning. They know where they're going. Because they can see it before they begin the treatment almost, with digital smile design and virtual reality that's all sitting there.
And CBCT and the way all that's morphed together, and just that whole concept about planning is just a wonderful thing. And there are some dinosaurs who are still taking a little bit of convincing, but I was over at another conference, Marcus Blatz was talking, and one of the guys in the audience, who is a well-known dentist, said, well, why should I change from my standardized impression technique? And Marcus gave a number of reasons, and one of the big things was, when you look at the scanners nowadays, they all work. Virtually all of them are of an accuracy that means clinically they will work. So, if you want to sit back and look at the process of scanning and go, it's not for me, well, accuracy is not one of the reasons why nowadays. They're all accurate, they're all great clinically. And it's just a case of being able to treatment plan properly with using photography, using scanners, using CBCTs, even sometimes using wax-ups. I mean, going back to how we used to do it, sometimes face bows are still required, and I would say they still are required. So there's certain aspects which we can link it with the standard, the more conservative way of doing dentistry and the digital way of working dentistry, and those should be symbiotic, really.
Well, I mean, a lot of the studies that are coming out these days are showing. I mean, one of the studies that I was quoting yesterday was at 16% of an increase in time saving. If you combine an analogue methodology of creating an implant crown versus the digital aspect. So there's 16% time saving. It's almost like an extra day of work per week, really, when you think about it, that you're saving. So that's your time to do it with whatever you want. Either increase your profit by working more or go off and, sail your boat. So, all of a sudden, it's there, it's options for people that sort of takes them either out of the coalface, but what they're doing is working more time efficiently, and the evidence also shows that patients much prefer the inclusive nature of being a part of an intraoral scanning scenario where they can visualise their own teeth before their very eyes on a screen. It's a wonderful thing to be able to add to the clinical regimen on a given week. It's fantastic.
Fantastic. And on that theme, obviously we're talking about the amount of disruptive and digital technology there is in the field now, and coming into many aspects of everyday life. Where would you advise or see young dentists or dentists coming into digital dentistry, where would you advise them or encourage them to start?
I think that's the biggest problem. I think the dentists who are coming out, they are so digitally aware. They know so much faster than the old dinosaurs, as you say, who are fantastically clinically aware. So they're clinically fantastic. There's this gap in the centre where these people need to get together. The digitally trained guys still need to develop every possible clinical skill to get them to the point that the whole thing is marrying up beautifully. But the older person might need the help of the younger digitally aware person. And the shared skills, it's about helping each other and helping that close that gap that's in the centre between the millennials and the baby boomers. There's definitely something in there, and the help that is required within the profession to guide people along, with, again, the older dentist mentoring the younger, bringing them on through, helping them with their clinical skills. So ultimately the patient still needs a fantastic clinical job done, and just because the digital technology is there, it can be used to their advantage.
I think the one of the problems is, how does a young dentist make a decision about what digital dentistry that they get involved with, and that really is what DDS UK is about. It's about say, standardising the learning process, making sure the things that are being taught are being taught for the right reasons, that there's research behind it to back up them making a decision, because there's a financial basis to actually get involved in digital. So there's that aspect. And that's really, so DDS UK is there to try and get some control and stabilise the platform at the moment that digital dentistry is sitting on. Coming to a conference like Henry Schein Digital Symposium, that's a great way, because then you have conversations with dentists who are already involved with it, and young dentists can be inspired. I mean, you've got to keep the motivation going, and so that's probably a good place to start, is to get involved in coming to conferences, and then hopefully become a member of DDS UK, and we'll be able to guide them in the right direction.
Super. And digital technology obviously has an advantage when planning treatments to maximise predictable outcomes, but cannot replace the need for developing clinical skills. What's your thoughts on that?
Well, actually, I've just been at an implant conference yesterday, and again, there was looking at the digital solution. Sometimes it wasn't the right solution. So, and sometimes you get, especially in implant dentistry, you get into a situation where you think you can do it digitally, but actually you've got to have some surgical skills at the back of you to go, well, actually that isn't quite working. I need to go back to basics here and do it more in a standardised approach. So there is a risk that dentists will rely on digital dentistry to get them out of the problem, and yet they actually have to have that underlying base training to make sure that they really understand the biology behind things, and then be able to get themselves out of trouble. And so, I mean, Sinead, you do some much bigger cases than I do, and there'll be times when you do your surgery and you go, well, it's helped, you give me an idea where it is.
But there's a massive soft tissue aspect to this that the digital did not take into consideration, and ultimately you need your contours and everything to be looking perfect at the end, and so much of that is dependent on just basic surgical skills that need to be developed over time, and it can take decades to develop those skills. And that's the most important part. Ultimately, that's what the patient wants, is a happy face and a happy smile.
It's in conjunction nowadays. So nowadays it's linked. You've got to have your surgigical skills, and you really have to have your digital skills, and those two bits should be symbiotic with each other. But you can't just have digital. If you just have digital, you will eventually get into a world of pain. And if you just have surgical, you'll do a good job, but you won't maybe provide the best treatment for that patient and the most easy treatment for that patient if you'd actually been involved with digital.
It's about efficiency. It's about identifying a much more time efficient and safer mechanism. It just makes your clinical skills, marry with perfectly, as you say, symbiotically.
Yes.
So the whole thing should be working out to the advantage of the patient.
Yeah.
And what's your thoughts on this for implication for maybe younger dentists that are coming in and embarking on treatments that may be beyond skill sets? Any advice there, or your thoughts?
There's treatment planning. I mean, that's the key.
Mentoring, isn't it?
Mentoring, treatment planning, making sure that
identify a mentor early.
Quite.
Who can help you along and realise that there are skill sets that you simply should, or treatment plans you should not be embarking on just yet. And you can become a little bit gung-ho because digital says that it's all, oh yes, you can do everything, but actually they really need to be spoon-fed a little bit by the person who has got the experience.
Yeah, I mean, within ITI you have a SAP, which is, it's a way of deciding whether something is simple, moderate, or difficult, complex case. That's a really good system. I like that system. And I'd like to have that happen within the digital world, that we have standardising. Something's a simple case, yes, you can do it, not a problem. Something's a medium case, yes, I've had some more experience, yes, I can get on with that. This is complex, maybe I shouldn't deal with that. Maybe I should refer that to somebody else who maybe have some more, it's got some more skill sets than I have. So.
Well, it's got to get about protocoling, isn't it? And
yes.
that protocoling system that exists whenever you're identifying a case at the start, high aesthetic cases, identifying them early.
Pilot line.
I know. It's just the scariest thing when you realise somebody has a high smile line and fine scallop gingiva and
right.
gung-ho and
thin biotype,
yep,
and life could be difficult. So art of referral.
So the digital is not going to make it any easier, and it's not going to get you out of jail. You need the
but it allows you to plan
base.
for it. I mean, digital. Remember, it's also digital photography. So it's not just about scanners. Digital photography. That's a fantastic tool to plan your case and see the issues become very obvious when you're taking a photograph of somebody, more than actually looking
And
at their
video,
mouth.
and
You
video.
see it on the big screen, exactly.
And dynamic smile, I mean, we all know that the dynamic
Yeah.
smile, when they're moving in conjunction with their face, all of those things are hugely important about revealing what this patient shows.
The face scanners that are going to be come about, it's going to become easier for people to do that stuff, and that will make things more obvious. Co-diagnosis with the patient, all that communication element with the lab technician, with your patient, with the dentist, maybe with the consultant. You need to send that to your consultant to get an opinion from them. It's a evolving world, and we want to help that evolve in a controlled way to limit the risks to dentists to getting themselves into trouble.
And I mean, it's identifying a fantastic technician who understands everything you're trying to plan, and you're working. I mean, I don't know about you, but I spend most of my day, I'd say 3 phone calls a day to the lab. I think they'll get to the stage where they see my name coming up and they go, oh no, it's her again, it's her again. But I mean,
sure
it
they
works,
don't say that.
It works brilliantly in that they know exactly where they're going, because we're in just close communication the whole time. And the patient can identify everything because they can see it.
Yeah.
Super.
So it's great.
And obviously we can see the passion. Just tell me in as few words as you can, what does digital dentistry mean to you?
Well, for me, it means an easy life, happy patients. Yes, more financial control over my life as well. And I just think it's just exciting. I mean, we're at the forefront of digital dentistry right now with what's going on. It's not just the start. We're past that early learning curve. We're now going into more general, more people getting involved in it. And I mean, who knows where we're going to be in 10 years' time? We want to be involved with that. It's very exciting.
Yeah, exactly.
Still, I just think it's about staying on the pulse. It's just an exponential growth in this just technology. It's just exciting, and every single day the patients are just as excited as you, because it's just, as you say, it's the enthusiasm. It's just it's just incredible, and it's tangible, and the patients can see it before their eyes. And it's a wonderful way for patients to embark on their treatment. They're at the top of the list now.
Who would have thought we'd be here? 20 years ago, you have a conversation with 20 years ago. I mean, this would have sounded like something from Mars, wouldn't it? Amazing where we are. Incredible where we've come. Another 10 years' time, who knows where we'll be.
That's it.
And I think the most used word was patient.
Right, exactly right. Very, very patient-centred. That's the whole point of the whole process.
Yeah. Okay. And well, thank you, Sinead and Julian, for joining me here today. That's all from Digital Symposium 2018. I hope you've enjoyed the range of topics and subjects that we've discussed over the last few days. The interviews can be found on the Henry Schein page, YouTube page, so go there to check them out, and we look forward to seeing you at the next Digital Symposium. Thank you.